I am Mr. Sandeep Dattatra Kardile, M from Pharmaceutics, lecturer, Mala Rural Institute of Pharmacy, Sonai. I am giving presentation on Introduction to Different Dosage Forms, Part 3. First of all, contents of my presentation. In this presentation, we will come to know Introduction to Liquid Dosage Forms, advantages of liquid dosage forms, then its disadvantages, then what are internal liquid dosage forms, we will see in detail. After that, external liquid dosage forms. Firstly, we will see introduction. It may be defined as a solution is a liquid preparation that contains one or more soluble chemical substances dissolved in a specified solvent. So, solution, it is a liquid preparation that contains one or more soluble chemical substances dissolved in a specified solvent. That solvent can be water or other. Liquid dosage forms are intended for external, internal, or parenteral use. They mainly classified into two categories, namely as, so it is a detailed classification of liquid dosage form. First, internal liquid preparation, they are classified into monophasic liquid preparations and biphasic liquid preparations. Second, external liquid preparations, they are classified into preparation which are applied on the skin and preparations which are instilled into body cavities. Thirdly, preparation which are used in mouth. Advantages of liquid dosage forms, they are immediately available for absorption, administration convenient, particularly for infants, psychotic patients. So for a small child we can easily give liquid dosage forms, and also for psychotic patient also it is easy to give injections also. Then easy to color, flavor and sweeten. Liquids are easier to swallow than solids and are therefore particularly acceptable for pediatric patients. For a small child mainly liquid dosage form they are very useful. A solution is an homogeneous system and therefore the drug will be uniformly distributed throughout the preparation. Then some drug like aspirin, potassium chloride can irritate gastric mucosa if used orally as solid dosage forms, but this effect can be reduced by solution system. Then disadvantages of liquid dosage form, they are less stable in aqueous system. Incompatibility is faster in solution than solid dosage form, so they can be incompatible. Then patient have no accurate measuring device. So device it is given that 5 ml, 2 ml, but accuracy is not maintained by the patient. Then accident breakage of container resulting complete loss. A solution often provides suitable media for the growth of microorganisms. Then the taste of a drug, which is often unpleasant, is always more pronounced when in solution than in a solid form. Bulky than tablets or capsule, so difficult to carry, transport. So they are bulky as compared to solid dosage form, for example tablet. Firstly we will see monophasic liquid dosage forms. It contains only one phase. It is represented by true solution. A true solution is a clear homogeneous mixture that is prepared by dissolving solute in a suitable solvent. Monophasic liquid dosage forms are syrup, elixirs, solutions and linkages. So here in diagram it is example of true solution. Copper sulfate crystals dissolute, they are dissolved in water. So when properly they are dissolved, blue color transparent solution we get, and that is a true solution. One first monophasic liquid dosage form, that is syrup. It is a concentrated or saturated solution of a sucrose in purified water. The concentration of sucrose is 66.7% weight by weight, and due to that it is a viscous preparation. So 66.7 gram of sucrose in 100 ml of water. That is the formula for syrup. The syrup which contains medical substance called as a medicated syrup. When a drug is present there, it is called as a medicated syrup, and those containing aromatic or flavored substances known as a flavored syrup. So these are some examples of syrups available in the market. Pectoral, then Pyridine syrup, etc. These are well known examples, marketed preparations. Then elixirs. It is a clear, sweetened, aromatic, hydroalcoholic preparations meant for oral use. The medicated elixirs are generally contain potent drugs like as antibiotics, antihistamine, or sedative, where non-medicated elixirs contain flavor. The composition of elixirs contain mainly as ethyl alcohol, active ingredients, water, glycerin or propylene glycol, coloring agent, flavoring agent, and preservative. So this is one marketed preparation example given of elixir, pyridine, which is organic digestive elixir. Then linctuses. These are viscous liquid preparations that are used for treatment of cough. They contain one or more medicaments which have demulsion, sedative, expectorant action on the mucous membrane of a throat. They are taken in small doses without diluting with water to have prolonged effect of medicines. Simple syrup is used as a vehicle for most of the linctuses. So this is one example of a linctus, that is simple linctus BP. Then biphasic liquid dosage forms. The liquid which consists of two phases are known as the biphasic liquid dosage form. They are subcategorized into two different forms, namely as emulsion or suspension. In emulsion, both phases are available in liquid, whereas in suspension, finely divided solid particles are suspended in liquid medium. Emulsion. Emulsion is a biphasic liquid preparation containing two immiscible liquid, continuous phase and dispersed phase, melt miscible. The liquid which is converted into minute globules is called as the dispersed phase, and the liquid in which the globules are dispersed is called as a continuous phase. So this is example of emulsion. One is dispersed phase. For example, dispersed phase, it is a small oil droplets, and continuous phase it can be water. So it can be O by W emulsion. So two immiscible liquids, one is dispersed phase, that is internal phase, and more amount, that is continuous phase, it is also called as external phase. Types of emulsions. Firstly, simply it is classified into simple type: water in oil emulsion, that is O by W, W by O, water in oil. Then oil in water, that is O by W emulsion, depending on globule size. Micro emulsion, second fine emulsion, and special type of emulsion, that is multiple emulsion, that is W by O by W or O by W by O. So these are some types of emulsions. Then suspension. Suspension are the biphasic liquid dosage forms of medicament in which finely divided solid particles ranging from 0.5 to 5 micron are dispersed in a liquid or a semi-solid vehicle with aid of single or combination of a suspending agent. Next, in which solid particle act as a dispersed phase, whereas liquid vehicle act as a continuous phase. Then the external phase, that is suspending medium, is generally aqueous. In some instance may be organic or oily liquid for non-oral use. Like suspension also, here is a dispersed phase and dispersion medium, but here dispersed phase it is a solid, Its size is ranging from 0.5 to 5 micron and more continuous phase, that is dispersing medium. The particle size for non-oral suspension is so important to avoid grittiness to the skin. Skin stick व्हायला नको, grittiness नको म्हणून particle size important आहे. So this is example of the suspension. Water, sand. So sand, it is already in water. So this is example of suspension. The mixture still has undissolved solid particles settled at the bottom with some particles still floating. Example is well known example is paracetamol suspension. Then external liquid preparations. A, applied on skin. Lotion. They are usually aqueous, alcoholic or oily liquid preparations. They are intended for external application without friction or rubbing to the affected area. Means the area or on the skin we can apply this particular preparations. Then usually applied with the help of some absorbent materials such as cotton wool or gauze. It is generally used to provide cooling, soothing, protective and antiseptic action. So this is example of lotion, that is calamine lotion USP. Then liniments. Liniments are liquid or semi-liquid preparations meant for external application to the skin. Skin we can apply externally. Liniments. They are usually applied to the skin with friction and rubbing on the skin. They are usually alcoholic and oily liquid preparations. They are monophasic or emulsion. It can be biphasic. Means liniment can be monophasic or biphasic. Alcoholic liniments are used generally for their rubefacient and counter irritant properties or effects. Such liniments penetrate the skin more readily than do those with an oil base. The oily liniments are milder in their action and may function solely as a protective coatings. Liniments should not be applied to the skin that are bruised or broken. So this is an example of a liniment, methyl salicylate liniment, APF. So preparations, they are instilled into the body cavities. These are ear drops, nasal drops, nasal sprays, inhalations, douches and enemas. Firstly, ear drops. These are the solutions of drugs that are instilled into ear cavity with the help of a dropper. These are generally used for cleaning the ear, softening the wax and for treating the mild infections. The solution is generally prepared in water, glycerin, propylene glycol and dilute alcohol. So this is a example of a ear drop, ceramol ear drop. It is instilled in another picture. It is shown that how it is instilled into your pinna. The nasal drops. Nasal drops are aqueous or liquid paraffin solutions meant for instillation into nostrils. Drug in solution may be instilled into the nose from a dropper or from a plastic squeeze bottle. The drug may have a local effect, for example antihistamine or a decongestant effect. Alternatively, the drug may be absorbed through the nasal mucosa to exert a systemic effect. So some drugs, they are instilled into your nose through nasal drops. Nasal drops example, it is given nasal drop, grip stop. How in another picture it is shown how it is inserted into your nose. Then Douche. Now Douche is a device used to introduce a stream of water into the body for medical or hygienic reasons, or the stream of water itself. So it is one device through which stream of water it is inserted into your body. Douche usually refers to vaginal irrigation, rinsing of the vagina, but it can also refer to rinsing of any body cavity. So in vagina there is a need to insert some drug. So with the help of this particular device you can enter the drug in body cavity, that for example in vagina. A Douche bag is a piece of equipment for douching, a bag for holding the fluid used in douching. So in the diagram we can see this is a Douche, and through this it contains liquid preparation. After pressing it we can insert in the body cavity, for example vagina. For irrigation of vagina, this particular device, that is Douche, it can be used. And used in mouth. Gargles. Gargles are aqueous solutions used for treating throat infection by forcing air from lungs through the gargle that is held in the throat, dispensed and concentrated with the direction of dilution water before use. So for throat infection, liquid, it can be gargles. They can taken in our throat. After forcing air up to lungs, it can be taken. They are used into intimate contact with the mucous membrane or throat for a few seconds before they are thrown out of the mouth. So after taking it into the throat, after some time they are removed from our mouth, or it is thrown out of our mouth. They are also used for their antiseptic, antibiotic, anesthetic, astringent, alkalinizing and antifungal action. So like this it is taken in our mouth or throat, then it is spitten out of mouth. So this is one marketed preparation, that is garden, used as a gargle. Then mouthwash. These are aqueous solution with a pleasant or acceptable taste or odor. So these are aqueous solution which is having pleasant or acceptable taste and odor. These are used to make a clean, deodorize the buccal cavity, or used for oral hygiene and to treat infections of the mouth. So to make or clean or deodorize the buccal cavity, mouthwash it is used. They mainly contain antibacterial agent, alcohol, glycerin, sweetening agent, flavoring agent and coloring agent. So Listerine, Coolmint. So this is a marketed preparation of the mouthwash. Lastly, thank you. That's all from this part of the chapter. Thank you.